Hi, I'm Zaeem. I'm a fourth year dental student at King's College London, which is currently ranked best in the world. I had to just say that. In today's video, I'm going to talk about the top 5 tips on how to smash your dental interview. Now, the purpose of this video isn't actually to go over absolutely everything you need to know in terms of preparing for your interview. However, this is more so about all the things that I've learned over the years in helping a lot of people with their interviews. Throughout the years, I've also worked for different companies, just done lots of interview practice. Essentially, the purpose of this video is to share some tips that I've learned that not many people know about, which I kind of hold to as my secret weapons, if that makes any sense. The first one, which is a bit obvious, is knowing how to differentiate your answers from medicine or nursing. The reason why I say this is because why dentistry is such a common question. Knowing how to answer why dentistry is probably one of the first things that you'd have to know in terms of preparing for an interview. However, quite commonly, what people don't talk about is the fact that you should include in your answers something that differentiates you from medicine or nursing. For example, if you turn around and say, and this is the only thing you say, is that I want to help people. I want to do dentistry because I want to do a career that helps people. When I'm doing mock interviews, I always turn around and say, well, why not medicine? If they turn around and say, well, medicine's not as practical as dentistry is. Dentistry is really, really practical. You get involved every single day and you do things with your hands. That's true. Why not nursing? Nursing is a very practical thing to do. You also help people. Why would you not do that? So as you can see, you need to be able to differentiate the three. Well, you could say that dentistry is a fusion of the sciences and the practical element of healthcare. Medicine is very theory heavy. The sciences are there. With nursing, the sciences aren't there as much. It's not as applied in nursing as it is in dentistry and medicine. Dentistry is sort of that fusion between the two, the sciences and the theory and the practical. Not to say that medicine isn't practical at all, or not to say that nursing requires zero scientific knowledge. Obviously, that's not true. However, dentistry is sort of that in between. And mentioning that shows that you actually not only understand what dentistry entails, but it's dentistry that you want to do. The second tip I have is about empathy. You will almost definitely either be asked to or expected to talk about the skills that a dentist requires. Show in your answers that you know how to differentiate between empathy and sympathy. These are two very different things. Sympathy is being able to feel sorry for the patient. Empathy is showing an understanding as to what they're going through. It's putting yourself in the patient's shoes. And if you specifically talk about in your answers the difference between empathy and sympathy, it takes your answer to that one extra level. Number 3, this is a big one. Oh my God, I have to almost teach this to everyone that I do mock interviews with. Don't be afraid of awkward silences. Quite often, the interviewer may actually be sitting there waiting for you to finish to ask you a follow-up question. They've got things that they want to actually get through on their board in terms of questions. And if you just feel like you need to fill up the time, they may not be able to ask you follow-up questions. Another example of being okay with awkward silences is if you get asked a question and you're just like, oh, I have no clue, like what is it? Well, it's okay to ask for about a couple seconds just to think, you know, it's okay to do that. I did that in my actual interview. I said, I got asked a question. I just hadn't prepared this. So I said, is it okay if I could just have a moment to think? And the interviewer went, yeah, sure. And I just sat there. I tried to make it as less awkward as possible. I didn't want to look like I was like, I kind of just tried to remain confident in my body language as much as I could. Kept my shoulders up, chest back, smiling, and I just and it took me about 15 seconds, 20 seconds of just time to think. And then I gave a much better answer after I took that time to think. That is far better from you panicking, trying not to look like you're messing up. It's fine, you can do that. Be aware currently of COVID's impact on dentistry. Dentistry is one of the most impacted professions right now with COVID, as opposed to obviously many others. Something to be familiar with is the term AGP. Now, AGP stands for aerosol generating procedure. COVID, we know now that it is distributed through droplets. Aerosol generating procedures spray lots of droplets, like on a dental drill, on something called the fast handpiece, water is sprayed out to cool the burr down as it drills. When water is sprayed out of a dental drill, that's droplets going everywhere. If there's COVID anywhere along the line, that's going to then distribute that out into the environment. Anything right now in dentistry that's producing droplets going in the air or any aerosol generating procedures, AGPs are being avoided right now simply because they're a big red flag when it comes to the transmission of COVID. The last one isn't such a huge secret, but I don't think it's emphasized enough, is to be confident and smile. I don't think people talk enough about how you can develop the confidence to go into an interview. A lot of people will say, do loads of interviews. That is definitely true. do loads of mock interviews. But a lot of people don't actually talk about how wide the range of things that you can do to develop your confidence is. Just practicing your answers out loud in the mirror, that develops confidence too. Going to Tesco and telling yourself, well, I'm not going to use self-checkout, I'm going to use the actual checkout. I'm going to speak to a cashier, and then when I ask them on this receipt what the return policy is, for example, just to get a bit of communication, is that develops your confidence as well. Trying to start small talk with the the barista at Starbucks, all these things contribute towards your confidence. Essentially, you want to get to a place where you feel comfortable, you feel relaxed, and you can smile, and it comes out naturally in an interview. How you develop that confidence is just to do something again and again and again. But that something isn't necessarily strictly interviews. That something could also just be talking to people. So if you were like me and didn't have access to many people who did dentistry or medicine, just grab a normal friend, do a mock interview with them. Even if they have no clue what you're talking about in terms of AGPs, in terms of communication in dentistry, even if they can't help you with the dental side of things, just being able to have the opportunity to say your answers out loud, that will help in you articulating yourself in the interview as well. I hope that was somewhat helpful. It wasn't an overview of absolutely everything you need to know. If that was somewhat helpful and it did help you, then obviously do subscribe, because I'm going to be making a lot more content centered around dentistry, preparation, and that's all. I will see you all in the next one.